During this presentation, we will discuss schizophrenia and the problems that correlate with this illness, schizophrenia in minorities, and treatment for those who are diagnosed with schizophrenia. Schizophrenia affects less than 1% of the population, with its peak onset at the age of 18 to 25 years old. Those diagnosed with schizophrenia can suffer from delusions, hallucinations, manic episodes, and depression. Physically, the brain suffers irreversible damage as a result of excessive transmission between neurons. Many factors contribute to the presence of schizophrenia. These include genetics, prenatal and adolescent neurodevelopment, psychological health, and social living environment. Not only do patients suffer, caregivers suffer as well. A research shows that if a caregiver is not provided proper education and does not have a healthy support system, he or she will have increased stress, decreased mental health, and higher physiological distress.
Hi, I will now be talking about schizophrenia in the minority populations. Now, there have been many studies that show that due to many factors, the minority ethnic populations are more prone to a higher risk of schizophrenia. Now, one study by Tortilli and his colleagues focused on the increased risk of schizophrenia among the Black Caribbean migrants and their descendants since the 1960s. It was found that higher incident rates of schizophrenia and other psychotic disorders have been present for more than 60 years among the Black Caribbean ethnic groups in England. And the reason for this is because the risk factors played a role in some of the minority ethnic groups. Some of these factors included age, sex, socioeconomic status, discrimination, social isolation, genetic factors, infections, stress, and substance misuse. They also found that some of the minority ethnic populations, particularly Black, Caribbean, and African communities, are more prevalent to social disadvantages and threatening life events during childhood. Due to the likelihood of this exposure in minorities, it can increase the risk of schizophrenia. There have also been studies showing that immigrants have an increasing risk of both schizophrenia and other psychotic disorders. A study by Berg and his colleagues focused on investigating the impact migration experience and visible minority status had on patients with psychotic disorders. In their studies, they used a cross-cultural 5-factor model of the positive and negative syndrome scale with a variety of patients who had defined psychotic disorders. They found out that although immigration seems to be the likely effect of psychotic disorders, several studies found an even higher risk for visible minorities. The study was done to a large group that consisted of Surinamese and Moroccans in the Netherlands, African Caribbeans in the United Kingdom, and African Americans in the United States. Now, these patients had psychotic disorders, and this sample size made it very possible to differentiate between the white immigrants who were visibly similar to the majority population and the visible immigrants who were dissimilar from the majority population. So throughout the study, it has been proposed that the experience of being the exception to the norm over a lifetime contributes to the risk of psychosis, rather than the stressors of migration. Now, patients who are visible minority immigrants could be more prone to perceived discrimination or have experienced higher levels of positive and depressive symptoms and delusions. Now, I'm going to switch gears a little. I'm going to talk a little bit about the treatment of schizophrenia for ethnic minorities. There was a study by Westman and his colleagues that focused on the treatment of schizophrenia for patients. Now, there was a randomized clinical trial to test the efficiency of a family-focused, culturally informed therapy for schizophrenia. And what they did was they developed a 15-week plan to decrease the severity of patient psychiatric symptoms. There were also an examination to see if client-therapist ethnic match related to the satisfaction of the treatment. So after randomly picking 69 families and just completing the 15 sessions, the patient's conditions had significantly less severe psychiatric symptoms. The treatment efficiency wasn't due to the fact that the patient and the therapist was of the same ethnic background, but researchers believe that there's such a positive result towards this culturally informed therapy was because of the strengthening of family cohesion and the cultural context and spiritual interventions, which made it even more effective and relevant to the ethnic minority populations. Now, the study also found the benefits of cohesive family environments leading to less severe psychiatric symptoms, and lower levels of depression, anxiety, and stress in schizophrenia patients. Hispanic, Latino, and Black caregivers who viewed family as more cohesive also expressed lower levels of depression, anxiety, and stress. And some research suggests that the connection between family unity and emotional well being is not as strong in white caregivers than Hispanics, Latinos, and Black families. Overall, Westman and his colleagues, their study was found to demonstrate the positive outcome of this therapy of family focused culture informed for schizophrenia patients, and how that helped reduce the symptom severity for patients who suffer with schizophrenia. Now, the treatment does not need to be treated with ethnicities, but it can work for all ethnicities.
Treatment has changed drastically over time. In particular, since the 90s, treatment has gravitated towards a focus of enduring negative symptoms. Meanwhile, it used to be more focused on lessening psychosis. Symptoms in schizophrenia affect all aspects of people's lives, and treatments are designed to specifically address these particular symptoms. Psychotic symptoms are often treated using medications to help lessen these particular symptoms. It is unfortunate that many medications do not work well, and some people with schizophrenia are even somewhat physically resistant to the medications. Social cognitive approaches are very helpful on the other hand because they help people to perceive reality and social interactions in a healthier and more accurate way. The Netherlands have made a huge push towards removing barriers to schizophrenic patients because of how severely it was affecting individuals and because it was so expensive to treat. This led to them eliminating the cost factor in order to ensure that everyone was able to get their needs met. In turn, this seemed to lessen the amount of an acute occurrences and improve the lifestyle and prognosis of those struggling with schizophrenia.